Hello everyone, I'm Bomsoo Kim from South Korea. It's my great honor and pleasure to be part of this excellent program. I want to start with a case, a young lady, 27-year-old, who was driven to a suicide attempt due to severe depression and persistent ankle pain following a traffic accident 3 years ago. 2 years after total talus replacement, she has a smile back and has fully returned to her life. Total talus replacement has a history of over 20 years with limited but favorable long-term outcomes. Currently, several implants are available. They differ in materials, weight, design, and mechanical as well as biological properties. The cubeless talus is 3D printed using pure titanium, not an alloy, and is currently the only total talar implant with EU MDR approval. Why total talus replacement? A patient with bilateral talar AVN treated differently clearly demonstrates the answer. The procedure is relatively straightforward. Although it may appear aggressive, it is in fact minimally invasive. The incision is typically less than 5 centimeters, and the operation usually takes about 30 to 40 minutes. My record, 21 minutes and 39 seconds, skin to skin. TTR allows early rehabilitation. Range of motion exercises begin within 3 to 4 days, and patients start walking at 1 week, often without any assistive devices. I have now performed over 100 total talus replacements. The short-term outcomes of my initial 39 patients were published last year and showed excellent results. Let me briefly go through some cases. This patient is walking very naturally at 3 months postoperatively. In contrast, she had significant pain and difficulty walking before the surgery. Here is a case of talar collapse with subsequent varus deformity, which was well corrected after replacement. A completely collapsed talar body successfully restored. Post-traumatic cases often present with ankle stiffness. TTR combined with Achilles lengthening restored good range of motion, and the patient stated, "I can't remember what it felt like to be in pain." A near normal ankle can be achieved when the tibial plafond is intact preoperatively. Even in the presence of talar necrosis, if the plafond and joint space are well preserved, excellent outcomes can be expected. Again, intact plafond, excellent function. And near normal, pain-free ankle. How long will it last? My overall follow-up is still limited and requires longer observation. However, this is my very first patient doing very well at 5 years. Return to high-level activity is not routinely recommended, but it is possible. This patient said, "It's incredible to be back in the mountains skiing with my children." Return to heavy labor is also possible. This young man is walking up and down the stairs naturally just 6 weeks after the surgery, and returned to walk at 3 months. Now, a very interesting case. A pianist with bilateral AVN refused fusion as she would not be able to use the piano pedals with fused ankles. In addition, it would take more than 1 year for both sides to heal. So we performed simultaneous bilateral total talus replacements. The procedure took 80 minutes for both. She is extremely satisfied and functioning very well. Another bilateral case, simultaneous replacement and having breakfast the next morning, and early rehabilitation and walking at 5 days. And here she is doing very well at 6 weeks post-op. Varus ankles can be effectively managed with concomitant corrective osteotomy. TTR can be considered as a valuable palliative option in patients with metastatic disease. This patient was unable to bear weight at all preoperatively, but was walking independently at 3 months. Thank you very much. 감사합니다.